Different festivals are held throughout the year, with the audiences eagerly anticipating the colorful performances. But sometimes, performers tend to get injured. Good day everyone, you are watching SWAT TV. Seriously, we are great. I am Isaac, your host for today. We will be showing you the first aid procedures for three of the most common injuries. First is the dislocated shoulder. It is an injury in which your upper arm bone pops out of a cup-shaped socket that's part of your shoulder blade. The shoulder is the body's most mobile joint, which makes it susceptible to dislocation.
These are the first aid steps for shoulder dislocation. First, you must check and ensure that the surrounding is safe before calling for the nearest medical assistant. While waiting, do not attempt to relocate the bone when you are not a professional. Instead, support the limb in the position that the patient is most comfortable. Second, check the limb for normal sensation, color, capillary refill at the fingertips. A makeshift triangular bandage can be used as a sling. Move the injured limb as little as possible while securing the joint. Make sure to listen to the patient for any kind of pain after securing.
The second one is fracture. A fracture is a break, usually in a bone. If the broken bone punctures the skin, it is called an open or compound fracture. Fractures commonly happen because of car accidents, falls, or sports injuries. Other causes are low bone density and osteoporosis, which cause weakening of the bone.
These are the first aid steps for fracture. If there is bleeding and the fracture is open, place a sterile or clean cloth and apply pressure to stop the bleeding. Apply ice to the site of the fracture. Immobilize the injured area. Don't try to realign the bone or push a bone that's sticking out back in. Secure the fracture by wrapping a bandage. Treat for shock. Help them get into a comfortable position. Encourage them to rest and reassure them of their safety.
The third and the last injury is a sprain. A sprain is a stretched or torn ligament. Ligaments are tissues that connect bones at a joint. Falling, twisting, or getting hit can all cause a sprain. Ankle and wrist sprains are the most common. Symptoms include pain, swelling, bruising, and being unable to move your joint. You might feel a pop or tear when the injury happens.
If your ankle is just painful and swollen, remove ankle bracelets or toe rings right away. Then try the RICE method to ease your symptoms. RICE stands for rest, ice, compress, and elevate. First, rest the ankle and stop putting pressure on the affected area. Then, ice the affected area. Do this as soon as possible to limit the swelling after the injury. Remember to not apply ice directly onto the skin and try to wrap it with a towel. Next, compress or wrap the ankle lightly, not tightly, with an elastic bandage or ankle brace. For the first 48 hours, elevate or raise the ankle higher than your heart whenever you're lying down. If you still have pain and swelling, ask your doctor about over-the-counter pain relievers.
And those are the first aid procedures to do when a person had experienced shoulder dislocation, fracture, and sprained ankle. We Filipinos love festivals so much as it is a fun and a wonderful part of our culture. But remember to always prioritize and ensure safety first so that everyone will have a great time and the festival will be a great success. Stay tuned for more educational videos made by our SWAG team. I am Isaac, your host for the SWAG TV.